My name's Louise and I'm a neonatal consultant. For the babies that are in the neonatal unit, there's a whole team of professionals that are involved. Doctors, nurses, breastfeeding support, pharmacists, and we all work together as a team and assess our baby throughout their journey in the neonatal unit and adjust the feeding support that they need throughout their stay. The doctors and nurses will assess the baby and decide if they're able to have milk feeds. But for those babies that have been born preterm or perhaps are unwell with breathing problems or problems with their bowel, then they may not be able to have milk feeds initially. In those circumstances, we use a fluid called parenteral nutrition. To give the parenteral nutrition, we need to put a drip or a line into one of the baby's veins.
I'm Anissa, I'm one of the clinical pharmacists here in the neonatal unit, and we'll look at things like how much fluid they need, things like protein, carbohydrates, all the things that they would normally get from their milk, and then we can review the results and their growth to ensure that the nutrition that we're giving them is appropriate.
My name's Matt, this is our daughter Francesca, and this is my wife Louisa, and Francesca arrived prematurely. When Louisa said she thought she was going into labour, and I just thought, you can't be, you're only at 6 months.
The midwife, she started taking all my vitals and said, yeah, her heart rate's dipping. So obviously she's in distress. Best thing to do is have an emergency C-section. So yeah, it was a bit of a shock, but they were all brilliant and they really put me at ease, and everyone explained it really well.
I think for me the biggest relief was hearing Francesca cry.
Francesca was born at 29 weeks. I saw her briefly and she was perfect, but then she was taken away, and when I saw her next, she was in her little incubator with all her wires on and stuff, and that was really scary and it was sad. I couldn't hold her and I couldn't feed her and I could only look at her, you know. And
actually, it's quite a worry seeing the wires in the incubator, but I think that's reassuring as well, because it reassures you that if something does go wrong, it's going to get caught.
For our babies that have been born preterm, they won't have developed their suck as yet, so they'll need their feeding support for as long as it takes for them to be able to develop their suck.
We have a very sort of standardised approach to introducing milk to premature babies. We like to get mum's own milk, which is full of all sorts of beneficial factors for babies, things that protect against infection, things that help to mature a baby's gut, which is very important.
When the babies are well enough, we'll start to give small amounts of milk, and that may only be 1 ml of milk every couple of hours, and that will usually go down a nasogastric tube. So that's the tube that's in the baby's nose and down into the stomach.
We support parents in looking after their baby and educate them. So part of that is training them to do things like nasogastric tube feeding.
as soon as her feeds came up to a good point, straight away the nurse who was looking after her said, do you want to get trained in this so you could help? And I said that would be amazing. It was very technical and I thought there's no way I'm going to be able to do this, but it comes quite naturally, and it was quite a nice moment to have with Francesca. The nurses that looked after her were amazing. They were so good, and every time that I was in and I would do it, they would just make sure that I was doing it correctly, and I felt comfortable enough to do it because that was important as well.
It's amazing how nervous you are because of the wires, and eventually I plucked up the courage to say, oh, I'm ready to have a go now as well. But that was with Louise's guidance and a couple of nurses as well.
So Lucy's one of our premature babies that we have in the unit just now, and Dad's just delivering a feed through the nasogastric tube. So before he starts the feed, he does an aspirate and just tests the pH in her stomach, just to make sure that the tube's definitely still in the right place. And then he just attaches the purple syringe and just slowly administers the feed. I think Lucy gets 2 early feeds just now. Before they go home, it'll be 3 to 4 early usually.
One of the things that we really strongly encourage, and it's something we call kangaroo care, skin-to-skin contact, really helps to encourage maternal milk supply, and it's incredibly important for mums and dads as well.
Being in the hospital with her, it was easy enough, to come and see her and spend time with her and whatnot, but just knowing that I was going to be away from her was quite a daunting feeling, really. But the only thing I could do for her was to feed her. The team here were amazing, and they really helped me with the breastfeeding and the expressing, because it's not easy, and it's not easy when you've not got your baby close to you.
We do a lot to support mums, to help them to provide their own breast milk. We do acknowledge that that can be very difficult, even with the very best of help. But we are very fortunate to have the option of being able to provide donor breast milk in situations where mums, through no fault of their own, are just not able to produce sufficient breast milk, at least to start off with.
At first, when they said she was ready to go home, the first thing is that you're relieved and you're excited and you can't wait, and then you think, oh no, hang on, like I've been looking at this machine to make sure that she's okay, like what am I going to do when there's no machine there? You need to just kind of realise that the doctor and nurses wouldn't let you go home if she wasn't ready, and you know that everything's going to be okay.
She's 5 months old and she's brilliant. I think we got her home after just over 7 weeks in hospital. Getting her home was absolutely amazing. We had the long wait to get her home, but getting her back was great, and she's absolutely grand. She's like what you'd expect a new baby to be. She feeds really well, she cries really well, she sometimes sleeps really well, but there's no scars, there's no kind of impact of what she's been through, there's no physical signs or tangible signs. She has benefited from being where she was, and we're grateful for everything that happened, and we wouldn't change anything for the world.